Thank you for clicking on this video. If you're new here, my name is Rachel Ogweji and welcome to Rachel and More. In this channel, you'll find nursing contents, my nursing experience, lifestyle, beauty, and DIY, just about everything. So, why don't you subscribe to my channel? Hit that notification. If you're already subscribed to my channel and you're coming back to watch this video, thank you very much for your support. I'm going to talk about a topic very interesting. It's an old question and it's a new question. A lot of nursing students and people who are intending to go into nursing school ask this question. That question is, should I be a CNA or a patient care tech before going into nursing school or before becoming a nurse? Well, the truth is there is no yes or no answer to this question. The answer to this question depends on your background or what you've been doing. Some people already have a career before deciding to go into healthcare and become a nurse. Some people may have been a nurse in other countries, like some people might come from many African countries and they are already nurses before coming over to the US and they want to go into the nursing program and they do want to go into the nursing program. They might not need to become CNAs, or there are other people that used to be professionals in other fields of work like real estate agents, bankers, accountants that do want to change their career and go into the healthcare system or become a nurse. They might already be earning higher than CNAs, and becoming a CNA is just like downsizing. Just a side note, you must not, there is no hard and fast rule saying that you have to be a CNA or a patient care tech before going into a nursing program or before becoming a nurse. If you're still young or if you're just starting on in the healthcare career and you do want to get to know more about the healthcare system before you go into the nursing program, or not sure if you can make it in the healthcare system and you just want to try it out, I would suggest that you start from being a CNA, certified nurse aide, or a patient care tech. And I'm going to tell you why. You don't actually want to go to a nursing school, spend all that money, all that time and commitment only to get into the healthcare system and find out that you don't like it. That would be like wasting a whole time, a whole effort just to not even go on with the career. So if you're not sure, you're not convinced that you would make it in the healthcare system, but you don't want to give it a try, it would be nice to be a CNA or a patient care tech. That would give you a glimpse of what it feels like to be a healthcare professional. That would actually either motivate you or give you those reasons to walk out before it's too late. You don't want to be a nurse today, tomorrow, you're going for another career. Because nursing program is really hard. It's really demanding. You don't want to go through all that stress for nothing. So if you're not really sure, you've not made up your mind, you're still like, fingers crossed, I don't know if I should be a nurse or not. Well, try being a CNA. See how it goes. It will also give you an opportunity to get to observe the nurses, see what they do. Ask yourself, am I ready to do this? Am I ready to deal with patients from this perspective? Am I really ready to go into the nursing program? And being a certified nurse aide exposes you to take care of the patients. And when I mean take care of the patients, you intimately take care of the patients. That means you give them a shower, you feed them, you check their vital signs, you clean their number 1 and number 2. That means, yes, you have to clean all the mess. You have to see all the blood and everything that goes on in the healthcare system. And for some people, that might turn them down. Like, okay, fine, I think I don't want to do this. Well, for some other people, they might not care. They might just like patient care and do want to go on and become a nurse. So if you think that is something that you would want to do and you don't mind, well, maybe you're a nurse material. When I became a CNA, I actually saw how the healthcare system works, and I decided to, you know what? Let me go a step further, go to school and just become a nurse. So being a CNA would help you to interact with patients, will help you to interact with patients' family, with other co-workers. So it just gives you that basic foundation in the healthcare system. And most importantly, it helps you decide. And also being a CNA would give you the background knowledge that you need to go into the nursing program. What do I mean by that? When you start out in the nursing program, you start out with fundamentals, and in fundamentals, you're taught simple things like how to take vital signs, how to turn a patient or reposition a patient, how to feed, care, shower, or give a bed bath to a patient, how to record a patient's input and output, and how to chart what a patient ate, how much they ate, and all that. Those things that you learn in your nursing fundamentals is the same thing that you do as a CNA. This is why some nursing schools would allow their students to challenge the CNA certification exam after taking the fundamentals of nursing. This is the skills that is required of a certified nurse aide. So being a CNA or being a patient care tech and going into the nursing program, when you start out with all these fundamentals, you don't find it hard to understand some of the terminologies. I remember my first semester as a nursing student, we were taught how to do hand washing. This is one of the fundamental things that you're taught as a CNA. We are also taught how to do bed baths, how to put on, to don the PPE and to doff the PPE. That means putting on and putting off the PPE, that your personal protective equipment, like your gown, your mask, your goggle, and your hand gloves. These things you're taught as a CNA, and these are the things that you do as a CNA, especially if you're working with a patient that is on isolation or any precaution for any disease. You have to don or put on your PPEs before you go into their rooms. So going into the nursing program and being taught these things is just like teaching you what you already know and what you used to do as a CNA. You also communicate with the nurse. You tell the nurse if the patient have any change in condition, if they used to be active and today they are sluggish, if they used to be able to eat their food and today they seem like they're choking, or they seem like they can't eat or swallow their food, you get to report this to the charge nurse. But just imagine being a nurse or being a nursing student and going on clinicals. It's easy for you to observe these changes in a patient because this is the same thing that you would report to your charge nurse as a CNA. But being a nurse is just like you look at a patient and you know when they have a slight change in condition. I'm not saying that if you're not a CNA and you go into the nursing program, you might have problem communicating, but being a CNA, you already have that communication skills. So when you go in for your clinicals or when you become a nurse, it's not intimidating anymore to get into a patient's room, introduce yourself, and tell them what you want and what you want to do. So being a CNA also kind of gives you a job opportunity before you finish your nursing program. Most of the nursing students work in a healthcare facility, in a nursing home, in a hospital. Most CNAs gets rehired in their workplace where they used to work as a CNA. So don't you worry if you're in the nursing program already, or if you're already a nurse and you didn't have to become a CNA before getting into the nursing program or become a nurse. That's okay. It's not mandatory that you have to be a CNA. But it does help you in getting into the nursing program with your clinicals, with your hands-on. It actually helped me, and it could help if you can become a CNA before going to the nursing program. But some nurses didn't, even when they had to finish the fundamentals, they didn't even have to take the CNA exam because it's not necessary for some people. But I would say that being a CNA would give you some experience to know what goes on in the hospital, what goes on in the nursing homes, what goes on with patients. It will also give you experience to work with nurses and doctors, other co-workers in the healthcare system. And for some schools, if you're a CNA already, it would give them the motivation that you're committed to be in the healthcare system. But overall, you may become a CNA or may not become a CNA before going to the nursing program. It's actually 100% depends on your circumstance, your choice, and what you want to do. So I'm not advising that you must have to be a CNA before getting into the nursing program. No. What I'm just saying is, from my own experience, it did help me to transition, and if you can, that's okay. Thank you for watching this video. Let me know what you think about this topic, especially if you're a nurse, if you're a nursing student and you didn't have to be a CNA. Get into the comment section. Tell us your experience. Also, subscribe to my channel, Richie and More. Hit the notification bell. I'm going to be making more content, and I'll see you in my next video.